Pandemics. Although the COVID-19 virus of 2020 seems like completely new territory for most people today, much of its public health communication echoes and stems from that of the 1918 flu pandemic. Although the illness itself was very different from COVID, its worldwide effect on daily life was very similar. So how did we deal with pandemics a century ago? And could we have improved our communication of safety standards? The United States entered World War I in the spring of 1917. Shortly after, in June, the U.S. government passed the Espionage Act. It was created with the main intent to prevent military insubordination, obstruction of war recruitment, and the support of enemy countries throughout the war. However, in May of 1918, an amendment known as the Sedition Act was added to the Espionage Act. This amendment prohibited the use of disloyal language against the government. While seemingly inconsequential, this small addition meant that if the government was doing something wrong or inadequately, citizens couldn't speak out about it. Back in late January of 1918, the first signs of danger appeared in Haskell County, Kansas. While still uncertain to this day, it is thought that this is the location of the first cases of the H1N1 flu strain that would cause the pandemic. At the time, the standard flu was so common that it wasn't tracked by health officials like other diseases. However, a local doctor was so concerned about the threat of the virus that he sent his concern to the official U.S. weekly public health reports. Because his message was delayed until March 30th, historians previously overlooked this potential origin of the virus. Perhaps if word had spread sooner, preventative measures could have been put in place. The more well-known version of its beginning occurred a month later, when new recruits arrived at Camp Funston in Fort Riley, Kansas. 100 previously healthy soldiers at the camp came down with a drastic flu on the same day. In a week, over 500. The peculiar thing about this flu was that it hit people around their 30s the hardest, and although the initial symptoms were almost identical to the common flu, this strain could cause a lack of oxygen, turning skin blue as the lungs filled with fluid. It would also often lead to pneumonia, all of which only took a few days. This would have a drastic effect on the economy because the people most at risk were also the age of a large portion of the workforce. It began spreading from camp to camp, and eventually made its way to Europe on the battlefront. This was already out of hand, spreading across country lines to allies and enemies. More soldiers would die from illness than from actual battles. Most countries fighting in the war had laws that prevented pessimistic speech about their governments, like the US's Sedition Act. However, Spain was neutral in World War I, and therefore had no such laws. This meant that Spain was one of the only countries where case numbers were reported publicly because citizens and media could speak freely about the flu. Spanish influenza gets its name for this reason only. The second wave was by far the most deadly, with well over half of the US's recorded deaths happening in just 3 months. This spike was so devastating because it represents cities and towns that failed to communicate the significance and threat of this flu. Take Philadelphia as the prime example. On September 28, 1918, they held a Liberty Loans Parade to raise money and support for the war. The city was warned by public health officials about the danger that such a parade could cause, but their warnings went ignored. This was the single biggest superspreader event of the entire pandemic. Everyone was closely packed and almost nobody wore masks. As a result, an estimated 12,000 deaths are directly attributed to the parade. While the second wave showed how a lack of communication could drastically spread the flu, the third wave exemplifies cities who succeeded in communicating. Although the third wave was smaller overall, cities and towns with a larger third wave actually represent a greater success in slowing the spread by flattening the curves. Cities like St. Louis and Seattle, while having a smaller population, still had significantly fewer deaths overall. This is due to less people filling up the hospitals at the same time, and from public health messages that largely came from the Red Cross. It wasn't until October 1st, 1918, just after the Philadelphia Parade, that the U.S. Surgeon General decided the flu required a national response. He tasked the American Red Cross with supplying nurses, but they helped in many more ways as well. They also provided equipment and supplies for hospitals, set up kitchens for those suffering, and distributed pamphlets on prevention and safety at the local level. Because much of the Red Cross was separated by chapters, cities had varying levels of response. St. Louis was one of the most prepared cities when the flu eventually hit, due to the collaboration between the Red Cross and the city's health commissioner. They even converted a surgical dressing workshop into a mask workshop. From all of these factors, St. Louis, along with other cities that worked and communicated with the Red Cross, never really had large spikes. Conversely, some cities went completely the opposite direction. Not only did San Francisco have a terrible second wave, their third wave was not much better. The city had communication, but unfortunately, it was the anti-mask league who had the strongest voice. The Board of Health had been issuing recommendations, and the city tried to make mask wearing a symbol of patriotism. However, some still held resentment over being forced to wear a mask. The city eventually tried to require it by law, but it had to be repealed from political pressure. The repeal led to the city's second large spike, showing that collaborative communication is key. Much less well known is the fourth wave in 1920. Most places in the US and some around the world had a final wave, about 10 times worse than what a normal flu season would expect. And while in comparison to the previous 2 years, the last wave was not that bad, it's still surprising how infrequently 1920 is mentioned. The last wave's significance came from the combination of the flu's naturally high death rate, as well as a slight relaxing of regulations, as shown by the summer of 1919 appearing almost back to normal. The next year there was no spike because the virus had already infected about a third of the world population, and herd immunity was likely the way it died out. Estimates put the loss of life broadly between 20 and 100 million. But lost lives were not the only effect of this pandemic. Many daily lives were directly impacted as well, including notably children. Teachers and their students had to develop new socially distanced ways of teaching. This also meant changes like open windows even during the winter. As for adults, not only was the medical industry struck harshly, but many smaller professions like small businesses either went bankrupt or had to make sharp changes, like this photo of carpenters, who had to adapt into coffin making. Even so, some positive strides came out of this as well. Much of the data collected shows a trend that African Americans had statistically lower mortality rates across the US. This was contrary to most white scientists' racist beliefs that black people were more susceptible to disease. In fact, it supported the work of W.E.B. Du Bois, who argued that racial differences in disease and illness were due to social circumstances. Even newer research suggests that segregation could have acted similarly to a quarantine. We are currently in the midst of a pandemic ourselves, and to some it may seem like we're already through the hard part, but it is important that we continue to push through to the end. Collaboration with communication is the best way to make it past a pandemic.